Welcome to Sarah Podcast. Today we are looking at healthcare workforce in Ghana, the doctors, nurses, and midwives who keep our health system running. Imagine in a small town where a mother takes her child to a clinic, but there's only one nurse for hundreds of patients. That's the reality we are digging into. The challenges and practical ways to fix them. We'll tell this through stories of real people with clear notes for you to write down. Ghana's health workforce is growing. In 2005, we had just 0.53 skilled health workers per thousand people doctors, nurses, midwives. By 2018, that rose to 2.65, and by 2024, it's about 4.19. But the World Health Organization says we need 4.45 per thousand to ensure everyone gets proper care. We are close, but there's work to do. Let's look at the challenges shortages and uneven distribution. Meet Kofi, a doctor in a rural clinic in northern Ghana. His clinic has no steady power, and he's the only doctor for thousands of people. Last year, during a cholera outbreak, Kofi worked non-stop because no other doctor was nearby. Meanwhile, in Accra, hospitals have plenty of doctors. About 87% of Ghana's doctors work in cities like Accra and Kumasi. Rural areas like Kofi's are left with too few workers. This is called an even distribution. The problem is bigger because more people need care. Think diabetes or older people needing treatment. But we don't have enough new workers to meet this demand. Kofi's exhausted from long hours, and that leads to burnout, where workers feel too tired to keep going. The second one is brain drain and migration. Now meet Ajwa, a nurse in Kumasi. She loves her job helping mothers deliver babies, but her pay is low and her hospital's equipment is outdated. She hears about jobs in Canada, better pay, modern tools, and a chance to grow in her career. So she's thinking of leaving. This is brain drain. When skilled workers leave Ghana, in 2024, thousands of nurses and doctors left, and over 118,000 trained health workers are unemployed here because there's no budget to hire them. Why do they leave? Low pay and tough working conditions push them out. Better salaries and opportunities abroad pull them in. Some stay because of family or because moving costs too much, but many, like Ajwa, feel they have to go. 3. Stress, burnout, and lack of support. Ajwa's job got harder during COVID 19. Over 105,000 health workers in Africa got sick, including many in Ghana. Some passed away, others needed time off to recover. This left hospitals short staffed, and workers like Ajwa faced more stress. No one offered counseling, so many felt mentally drained. Also, tight budgets mean hospitals can't always train workers on new machines or treatment, making their jobs tougher. Now, let's look at solutions practical fixes for the future. Let's talk about fixing these problems. Ghana's health workforce strategy for 2025-2034 is a big plan to help. It focuses on training more workers, like physician assistants, to support doctors like Kofi in rural areas. In the Volta region, nurses are now trained to prescribe basic medicines or do small procedures. This is called task shifting, and it helps more patients get care. To keep workers like Ajwa, the government is offering bonuses for those who work in rural areas and better housing. They are also working with countries like the UK so workers can train abroad and return with new skills. instead of living forever. During COVID, Ghana hired unemployed workers and retirees to fill gaps, which helped a lot. Also, supporting workers and building capacity. Another way to help is supporting workers' health. Imagine Kofi's clinic having a counselor to help him manage stress, or more training centers in places like Tamale, so workers don't have to go to Accra to learn new skills. Ghana's working on hiring those 118,000 unemployed workers by putting more money into health budgets. A 2024 WHO program trained workers on diseases like malaria, showing we can build skills without spending too much.